Now we're talking about probiotics. We have talked about all different kinds of diseases and conditions, and now let's chat about probiotics, the magical buzzword these days. These are my disclosures. I'm a clinical pharmacist. I work at the primary care in Hamilton with the family health team, and I'm also the author of the clinical guide to probiotics products in Canada and US. And I do like beneficial microbes, regardless who makes them. So, what are probiotics? You have heard this word probably everywhere. You know, your bread has probiotics or prebiotics, your dog food might have it, your skin shampoo and everything else. So, it is one of those kind of popular, sexy buzzwords. But what are the definitions of probiotics and the appropriate terminology? Are we allowed really to use the word probiotics for everything they are now using it for? So by a proper definition, probiotics are live microorganisms that, when administered in adequate amounts, actually have a health benefit on our body. So by that definition, really, many products that have a little bit of a probiotic in a label or something similar probably are not, should not be used or defined as such. It's interesting to note that in Europe, they really cannot use a word probiotic because they have to have a proof. They have live beneficial microbes in adequate amounts, but we tend to overuse it. So let's just kind of talk about it. We know globally, not only in North America, probiotics are extremely popular. If you walk in a pharmacy, grocery store, you check your email, you'll get the ads for probiotic everywhere. There are tons of them. Research, as well, as we did see this evening, is exploding. There's more and more scientists looking at the role of microbiota and probiotics as intervention for many different issues that we face. So that is a fact. So what is the problem? Where this confusion comes? So what we know is there are some barriers to proper use of probiotics. Not really knowing what probiotics to choose and how to choose it. Is it because it's a shiny label, or because we've seen it on TV, or is it because our friends and neighbors are taking it? Or maybe it has more bacteria, or maybe it's refrigerated. So we'll chat about these kind of guiding principles with the probiotics. What we know is that we need to be really specific about a strain of probiotic and using appropriate one for appropriate disease prevention or disease treatment. So really need to be very specific. And again, there are some very persistent myths that are not only in general public and with patients, but with the physicians and prescribers as well. So we'll address some of these myths right now. So I mentioned with the earlier talk to practitioners, we don't really tell our patients to go to the pharmacy and get a drug. We tell patients to get a medication, such and such name for such and such long time, what dose, etc. So you should not be told by your practitioner to go to the pharmacy or the store and get a probiotic. You should be told what strain and for what reason. So some of the persistent myths are that the best probiotics are kept in a fridge. My patients refuse to purchase or take my recommendation for probiotic that is not refrigerated because they heard only those in the fridge are good, the others are dead already. That's not true. It really is strain specific. Some strains are resilient to temperature, oxygen, etc. So they will survive for a long time in a capsule or tablet or powder if it's kept at the room temperature. So this is a myth. Some that are more fragile strains, they need to be refrigerated. Another myth is more the better. So more billions I see, it's probably better, So if there's a one with a 500 million, there's better for 10 billion, maybe 500 billion is even better. I've seen all those. So again, really, it doesn't matter how many, as long there is evidence for specific strain in specific amount for specific outcome. So some probiotics are active with 500 million a day and have great evidence for different kinds of indications. Some others we need to go with the much stronger, like 450 billion per day to get the effect. So I like the illustration of the little fish, kind of put more in a little aquarium. It's not really better. L. acidophilus is a strain. My patients come to me and say, I am taking this acidophilus, and acidophilus actually is still a family. So lactobacillus is the big kind of a country. Acidophilus is a little family in a country, and then the family members will have to have first names or nicknames to differentiate, and not all of them will be the same. So again, this is kind of where the confusion comes. What is the strain? What is the species? And why is this so important? To illustrate that, again, getting to the science, I like to use this. So you have a genus, species, and strain, and this is how we classify the bacteria. So we have one that is Lactobacillus reuteri and have all these kind of fancy letters and numbers. Is this that important? Is it really that different between the strains? So to kind of dry the message, this is what we see. So let's say the genus is the human beings, and then species are healthcare professionals. They tell us that we are a really specific species. And then athletes, on the other hand, I'm sure that you would rather listen to Dr. Oz than me today. But again, we are both healthcare professionals, very different in what we do. And those two athletes, even though I do not follow the sports, I've been told by my kids these are good examples, they do different sports. So imagine putting us all together to play hockey against Maple Leafs. I'm not sure about the others, but I think they'll kill me first because I have no idea how to skate. And then, so really, you have to be strain specific. And also, if you are mixing the strains together, you have to know they are working well together. So these are kind of another myth that, more strains I put together in this mixture, it's going to be better. There are some products with many strains with the great evidence, and there are some that we have really no idea what happens once we put them all together. So really, more strains, the merrier, is not true, and it's another persistent myth with the public and with the healthcare professionals. So again, all probiotics will do the same thing. That's another cure-all myth. That's not true. There are, again, specificities, and different strains will do different things in our body. So this is what we know so far. There are also myths about probiotic supplement needing enteric coating to reach the gut, because either acid in the stomach will kill it and we have to get this specific coating. Other products will not do. So again, it comes to the strains. We do have bacteria in our mouth. We have bacteria even in a high acidic environment in the stomach. So again, that is not, again, just another persistent myth. So food, we can get all the probiotics we need from your diet. We do need to have a balanced diet. We have a great talk by Andrea earlier. So we have to have food to feed the bacteria, but the probiotics in food sometimes is not enough to be used as an intervention, as a treatment. So fermented foods are great, and we also need to pay attention to our diet to actually have proper food provided to the gut bacteria and microbiome. So how do we choose the right probiotic? And, first of all, as a pharmacist, I like to tell my patients, do not self-diagnose. I know it's very tempting to ask Dr. Google, but you ask your real doctor first. If you go to Dr. Google and ask Dr. Google, what probiotic should I use? I get 2 million answers. If I say, okay, let's be specific, safe and effective probiotic, I get, again, almost a little bit less than 1 million. Let's get, as a pharmacist, I'll say, okay, let's do this clinical evidence to recommend to my patients, again, close to 1 million answers. So Dr. Google is not very specific, even though my patients will actually bring me the printouts and ask me about it. So again, in kids and adolescents, which is the kind of a theme for today, these are some of the indications that we have evidence to support use of specific probiotics. And you can see that some of them are associated with the gut, but some of them go to liver, some go to eczema and dermatitis, minimizing the risk of the common colds and flus. So again, all different kinds of things we can use probiotics in kids and young adults. And this is why a group of my colleagues and myself, we put together this clinical guide. It's like helping navigate how to choose a probiotic or strain for specific desired outcome. This is something we do every year, and it's been going on for 10 years in Canada. And what it is, basically we get together, look at what's published, what's the evidence, and what is available on the market, and then match it with the proper indications. So indications are different. We have things for vaginal health, we have things for mood and affect, we have things that are only for pediatrics, so all different kinds of things are there. And those are not what you will see on the label of the product. These are based on outcome in well-designed studies. And again, when you look at how they are like 16 pages like this, lots of information, kind of very confusing. But again, just to illustrate, here are the brand names, what strains are available, what format, and you see what is this used for. Lots of empty boxes. So not every probiotic is for every possible indication. Some of them have maybe one indication, some have a little bit more. When you look at a bit closely, you'll see these kind of numbers. There's a level of evidence, 1, 2, and 3, 1 being the strongest. There's also a little maple leaf on some of the products and indication. That means that company has applied and got approval by Health Canada for specific indication for that particular product. And there are references basically looking at the studies used to assign that indication and level to this particular product. There's also indication what products need to be refrigerated and those that are gluten-free. So lots of information on one little page. You need magnifying glass or with good glasses to see it. You could also, so the print formats are available, and I think there were some out there on the tables if you'd like to pick it up. And then they are divided by adult, pediatric health, vaginal health, and functional foods with added probiotics. And there are some tear-off pads that clinicians use in offices to give out to patients. It's available online as well, much easier to read. You can actually click and see the references in a much larger format. You can also find what you need and export as a PDF to print. So that's much easier to navigate. Everything that you see on a print is available online, and it's available on mobile apps. So all data is there. Lots of good work done by IT department in our company that puts all these 170 references on a little mobile app. And those apps are free of charge. So basically, bottom line is, if it comes to probiotics, really talk with your doctor, pharmacist, dietitian. Make sure that you have proper diagnosis or you know why you're needing to take probiotic, and help them with providing this information, select appropriate probiotic for your desired outcome. And again, if you're healthy, and you eat good diet, and we don't have much stress, physically active, you might not need to take probiotics. Not everybody needs to take probiotic to stay healthy. So again, make sure to talk with somebody about it. And I'm very happy that I'm actually a second to say thank you.